Hi guys, welcome back to my channel. I know that it's been a hot minute since I uploaded anything, but I just thought I would, and I am outside drinking my coffee. It's like 8 a.m. and I thought what better time than now to film something that I've been wanting to film for a while, but I felt like maybe I don't know why I had hesitations about it. But the thing that kind of just made me say, okay, let's do it, was Anna Sacone's, the Sacone Jolie's channel that I've been following since they started, literally since, I want to say, I've been following them since their wedding, which was like 4 years ago on YouTube. If you don't follow them, you've never heard of them, please go follow them. They're awesome, really cute family that I think I don't know if they live in Ireland anymore. Beside the point, she followed her through her 2 healthy pregnancies, and she just about a month ago announced her 3rd pregnancy, and then this last week uploaded her miscarriage video. And watching that and listening to what she had to say about when she was going through the miscarriage, and when she was looking on YouTube and looking for videos to kind of like help her through the whole process and to see what other people went through, and kind of how what I was talking about the first time that I had the miscarriage in my first video, kind of the same things, and it kind of brought back the reasoning behind the reasoning behind why I posted that video in the first place, which was to help people, to help women in similar situations, to remind them that they're not the only one, and that life does move on, and you can regain that hope. And as you can tell by the title of this video, I've had a 2nd miscarriage, this time at 5 weeks. So kind of just a little backstory. If you're not familiar with my situation, I found out I was pregnant last year at this time in May, and I miscarried at 7 weeks. Don't really know why. You can, if you want to watch that video, I kind of talk about a little bit of what the doctor thought and everything. I had a cyst that I had gotten an MRI done in March of last year, a little bit before I found out I was pregnant. And the doctor said it wasn't dangerous, I shouldn't remove it, it's fine, it's fine. He said it's fine. So it was pretty large too. I want to say it was 5 centimeters. Sorry, if I like slap at something, there's so many mosquitoes in our backyard, because there's like a big kind of like ponding basin like on the opposite side of our house, and so it attracts a lot of mosquitoes. But anyway, yes, so I miscarried at 7 weeks, and then it took us a while to get pregnant again. So we started in July after I had a first period, and then in January of this year, 2016, we found out we were pregnant for the 2nd time. And I was nervous, of course, especially going into this one. I wasn't nervous with my other one, but I was definitely nervous with this one, thinking like all the signs, you know, am I miscarrying? What's happening? So yeah, I only had about 2 weeks of knowing that I was pregnant until I had my first miscarriage sign. It was on a Saturday, and my husband was working, and my family, they were all busy doing their own things. So I was kind of just stuck, not knowing what was going on. And I think that was the hardest part for me that day. The miscarriage part wasn't hard for me, and that sounds horrible, but it was hard because I didn't know if my baby was living healthily inside me or if it was dying inside of me. And that not knowing period was the worst pain in my heart that I could ever feel. Like I don't think there's nothing worse than that. And so the first sign was that morning I wiped, and of course I analyzed everything when I go to the bathroom because I just don't want there to be blood. And it was kind of like a dark yellow. Instantly freaked out, not, you know, anything abnormally from what I'm used to, is not something that I want to see. And so I watched it the rest of the day, and then it turned into a really dark brown. And it became to the point where I needed to put on like a panty liner to track it. And then it kind of went away, and I didn't have much cramping. I called my OB who was on call that day, and he said there's nothing to worry about. Of course, it's what they tell you. So you're fine. He said, but book if you're pregnant, he actually sees people sooner than 8 weeks, because usually OBs, around here, they don't see you until you're 8 weeks pregnant. But he actually sees them sooner. So he said, book an appointment for next week and we'll get you checked out. So that next morning, I had worn a pad during that night sleep, that Saturday night, and I woke up at 5. Something woke me up. And I went to the bathroom and I looked down at my pad and it was dry, and I'm like thinking, I'm fine. Like, there's nothing wrong with me. And then I looked in the toilet and it was just over. And at this point, if you don't want to hear about graphic things, or if blood freaks you out, or gives you like squirmy feelings, you should probably X out. Or if you don't really care about that sort of thing, you could X out right now, because I will be talking about blood. So yeah, it just flooded out of me, worse than any period that I've ever had. So that day I knew, at that point I knew what was happening. I didn't even have to call a doctor. I just went through it, all the pains on my own, like I did last time. This time the pain, the pain is horrible. Like, there are some people that I've talked to who have had miscarriages, and they're like, I never felt anything. Like, it's like cramping, and then it went away. My 2 miscarriages have, honestly, when I talk to people who have delivered babies, it's almost like a birth, because you're getting rid of the baby inside of you. Well, obviously you're not getting rid of a 9-pound baby or a 7-pound baby. You're getting rid of the fetus, which I don't even like calling it a fetus, because it seems so demeaning. Like, it just feels like you're just putting a name on something. Like, it's a baby, it's a human being, it had a heartbeat, like all of that, like, you know. Anyway, moving on. So yeah, it was very, 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 very painful, cramping. Felt just like someone was like wringing out my insides, and I think I've explained that before, and it's the same pain. I had a heating pad on me pretty much the whole day, and I remember it was sunny that day. It was in February and sunny, so I was sitting outside for the majority of the day just trying to get some vitamin D. But physical pain I could handle. The emotional pain that came with this was really bad, because it was the second time around. You just feel so defeated. Nothing can prepare you for 1 miscarriage, let alone 2. And I know a lot of people watching this have had more than 2, and it's one of the worst things to have that ripped away from you. So after, let's see, yeah, so that was February. I switched over to a new OB after I went in for that appointment after my miscarriage, because he was just awful. Like, just kind of shoved it off and said, that must suck for you, and gave me an exam and said, I'll schedule a surgery to have your cyst removed, and I'll see you then, and shut the door. So my husband and I didn't really want to do the surgery with him, didn't feel comfortable. I didn't want to continue with that. So we did a lot of research. We asked around to people who we felt like would give us an honest review on who they really liked. So I ended up going with a family member recommended an OB, and it took about a month to get into him. So I got in the end of March, and that was amazing. And in the meantime, I decided that I wanted to try to get rid of my cysts naturally. I don't want to go into that too much right here, because it could be a whole series of videos of what I did. But I worked with my chiropractor one-on-one for 2 times a week for 3 months. It was a lot. We made some progress. We made a lot of progress as far as like where my body was. I've never been more sick in my life than I have since my miscarriage. I just feel like my body hasn't been the same since. I'm sick right now. I have really bad sore throat. I don't know if you can tell, but yeah, it's just, I feel like every 2 weeks I've gotten something. I don't know if that's related to the miscarriage, but it has to be. I feel like I'm just holding on to a ton of toxins. It's not releasing. So we've been working with that with my chiropractor. And in the meantime, I knew I needed to find a new OB. So I went to that one that my family recommended, and he was absolutely amazing. Christian guy, just super, felt like I could just talk to him about things and have him, he was so informative and spent like an hour with us talking over options. And at the beginning, before he saw any scans, it was just us talking and me explaining my situation. He didn't think that the cyst and the two miscarriages were related. So he said, he recommended that, you know, if it's not causing me any pain, then I should just leave it. And the next 2 months do some blood testing to see if there's anything wrong, like to see if I'm not generating a protein, because he kind of explained it in a way where a lot of miscarriages happen within the first 48 hours of conceiving. So if something goes wrong, there are thousands of things that have to coincide for something to happen correctly. And if one of those pieces is missing, that's when it happens, is within the first 48 hours, and it may not appear until 5, 6, 7 weeks later, and then you miscarry like 7 weeks. So he was wondering if that was my situation, so he recommended doing some blood testing, and we did. My blood work came back completely fine, normal, healthy, great. I also got a scan, an ultrasound done in his office, and he looked at it last week, called me back, and basically said I needed to have it removed. He didn't realize where it was located. It's literally right smack in the middle of my uterus, and makes sense to me where he kind of described when the baby is formed and it starts to grow, the cyst grows with it and pushes it right out because there's no room for it to go anywhere. Because whenever I ovulate or whenever I'm on my period, I'm very uncomfortable. I've taken pictures before. I should insert them here, but it's I deleted them all because they were so gross to me. I look like I'm 6 months pregnant when I'm ovulating. I can't wear jeans, and I can't wear normal things that button. I have to wear yoga pants because it's so painful because my cyst swells, as well as when I'm on my period. So, and it used to do, I mean, I want to say it's grown. My cyst has grown a little bit because I don't remember that pain being there. And so yeah, it also has, the scan showed that it had scar tissue wrapped around it. You can kind of see gray squiggly lines wrapped around the cyst, which means that it's been there for a long time, like probably since I was little. So long story short, my chiropractor recommended, because he sent a few patients up to Stanford to get this specific procedure done, because he trusts the doctors up there, and they specifically, what is that word? Specialize. There we go. Oof, let's get out. They specialize in this. And I called, and without, even with a doctor's referral, with my OB's referral, the chances of getting in is few and far between. I don't really need to get into that, but it's hard to get into Stanford. I ended up making an appointment with my OB that I really like, because I feel really comfortable with him, and he explained that, you know, he loves doing surgery. He's very successful with surgery, especially with this kind, which is a laparoscopic cyst removal, which I don't know if you guys are familiar, but you go in through the belly button, and sometimes they make a small incision down kind of below your bikini line, and they take a fiber optic tube cord up there. They cauterize the cyst out of your skin or whatever is in there, and they drain it, and then they'll probably do basically what they should have done the first 2 miscarriages, which is a D&C, but no one recommended that, which I needed to have it done. And that's where they just scrape away your uterus, wipe it clean, and basically start fresh. So I'm really, really, really anxious to get this done. I have the surgery scheduled for next month in June, and I have my pre-op appointment at the end of this month. So I know I don't really sound that emotional about this. It's just because it's been since February, and it's now May, and I've had a lot of time to grieve. I've had a lot of time to think about this, and it's been a long process for me. So I don't want you to think that, I know my first miscarriage video, it's very emotional and I cried throughout the majority of it, but I've just had a lot of time to think about it, and it's been a long time for me to, you know, grieve, take my time. So anyway, that is my situation. That's the surgery situation. I think we finally have our answer as far as why I'm miscarrying every time. Working with 3 doctors has been, it's been a lot, to be honest. It's been overwhelming at times, but I'm glad I'm down to just 1 OB and 1 chiropractor, and I'm able to get pregnant, and I'm so incredibly thankful for that. I know a lot of people aren't even able to get pregnant, and the fact that I've been pregnant twice and I've been able to experience a baby, a miracle growing inside of me twice, is just astounding to me. When I get, hopefully, the Lord willing, if I get pregnant with a 3rd one, it will not be my first pregnancy, it will be my 3rd pregnancy. Like, those did count. And you know, if you have had a miscarriage, your first one 100% counted, even if it's in the middle of having kids or wherever it's at for you in your life. They shouldn't just be shoved away, and you shouldn't forget about them, because that baby did happen, and it did form, and it meant something. That's that. Again, I feel like this is just more of an informative video to kind of tell you guys a little bit about where I've been, what's happening with me. And yeah, moving forward, I feel, for the first time in a while since I scheduled the surgery last Friday, I feel like, all right, I'm doing something. And I told my husband, there's no way that I could just say, let's try to get pregnant, without trying absolutely every single thing that I could to avoid another miscarriage. And I think we finally nailed it on the head, and I think that everyone's been telling me, doctors included, this thing needs to come out. So it's scary. I hate surgery. The only surgery I've had are my wisdom teeth, and they were only my top ones. I didn't even have my bottom ones removed. So yeah, it's scary. It is. But I'm excited to start this again, you know, because everything's kind of been on hold since February. And I'm excited to start the TTC journey again, and I'm excited to see what the Lord has in store for 2016. So yeah, thank you guys for watching. I really hope this helped you kind of understand a little bit. Maybe it helped you if you're going through something similar. Miscarriages are not easy, and I don't know why, frankly, they exist. Wouldn't it be awesome if you should just be automatically guaranteed you could carry a child for a full term? But I've grown, and I am a different person because of it, and I'm a mother because of it. Like, I count myself as being a mother for how long ever I was. Like, that just doesn't go away. Even though pregnancy loss is different than, you know, a child loss, it's still a loss nonetheless. That's all for now. I don't know what the next thing I'll be posting. Maybe kind of my pre-op appointment, my journey, that sort of thing. And then I'll be posting, of course, hopefully the results of my surgery, and maybe my husband can kind of film that process when it happens. Not like going in there and filming during the surgery, but afterwards and stuff like that, my recovery. So thank you guys so much for watching, and I love you guys, and I'll talk soon.